So today we'll be starting with the nervous system. This is the last system in our body that I'll be covering, and this will be the last lecture. Okay. Should we start? Okay. So the nervous system is the most important system of the body as it controls the other functions of the body. It is the CPU of our body. Like our the computers have their CPU like that. Our body has the nervous system, which is the CPU. If you will look at this diagram over here, it can be divided into central nervous system and peripheral nervous system. So, central nervous system consists of the brain and spinal cord. Okay, because they are the main control systems, and peripheral nervous system includes the peripheral nerves in the body that are spread out throughout the body. Okay. So, functions of nervous system, sensations. The nervous system receives and interprets sensory information from the body and environment like touch, temperature, pressure, taste, vision, pain, vibrations, and sounds. Okay. Just because our nervous system is working, that is why we can sense all the sensations in our current environment. The nervous system controls movements, balance, and coordination. So all the movements that we do, um, skeletal movements, involuntary or voluntary movements, balance while walking or while dancing, while yoga, all of this is controlled by the nervous system. Thoughts and emotions. The nervous system regulates thoughts, emotions, memory, and learning. Nervous system also controls our sleep and sleep patterns. Nervous system controls the heart rate and breathing patterns. These are the systems that keep the body alive, and that's why nervous system has a control on them. Integrating information from different parts of the body and processing them. So basically, we have all of these different systems in our body: respiratory system, circulatory system, endocrine system. So the nervous system interconnects all of them. Basically, it is the boss, you can say. It interconnects all the departments. There are two parts of the nervous system. CNS means central nervous system. Central nervous system consists of the brain and spinal cord. And peripheral nervous system, all other nerves in the body, okay, that branch out from the spinal cord. See, this will be the spinal cord in the center, and it's not shown in this picture because it is not part of the peripheral system. But the nerves that come out, all of these nerves, they constitute the peripheral nervous system. So let's see the division of the nervous system. So CNS has the brain and spinal cord. It integration and command center of the body. This is the main center. You can say the CEO of the company or the boss. Okay. Then peripheral nervous system. Peripheral, it consists of peripheral nerves. Now, what are these peripheral nerves? They consist of spinal nerves and cranial nerves. Spinal nerves means nerves that come from the spinal cord, and cranial nerve means that nerves that come from the brain. Okay. Then autonomic visceral nerves and ganglia. Ganglia are, you can see a small group of neurons in different parts of the body. Okay. Conveys the information between CNS and the rest of the body. Okay. Basically, these are the middle messengers. It takes information from the CNS and gives to the other parts of the body. Now, peripheral nervous system can be divided into two parts: somatic nervous system and autonomic nervous system. Soma means body. Just remember that. If you remember soma means body, then you'll be able to understand properly what it means. It's easier to remember. So, sensory fibers from the skin, skeletal muscles, and joints. Okay. So just remember that somatic nervous system, soma means body. So this is related with the body movements, muscle movements, joint movements. Okay. and motor fibers to the skeletal muscle. I'll explain what are motor fibers in the upcoming slides. So sensory, afferent, and motor, voluntary motor, efferent information flow between CNS and periphery. I'll explain this. Okay, but just remember, soma means body. So somatic nervous system is related to the body movements. Okay, autonomic nervous system. Autonomic means automatic, something that we can't control, involuntary movements. So, what does that include? Sympathetic nervous system, parasympathetic nervous system, and enteric nervous system. Enteric means intestine related. So, our digestive system. Can we control our digestive system? No. It works automatically. So, it comes under autonomic nervous system. Involuntary motor controls of the organs and body functions. Okay, so can you tell me what is the basic functional unit or the basic cell of the nervous system?
Neurons.
Yes, correct, neuron. So neuron means nerve cell. Okay, you can say nerve cell or neuron. It has a nucleus. If you look at this picture, it has a nucleus. It has a short processes coming from the body, which are called dendrites. Now, this is the nucleus and this is the body. Basically, the head. You can say this is the head and this is the tail. And from here, you have these processes coming out. These are called dendrites. And there's one long process called the axon. This long tail is the axon. And myelin sheath. Myelin sheath is a sheath of fatty material around the axon. This purple thing, can you see? This is the axon, which coats the axon, which acts as an insulator. If you know about wiring, you know, we have copper wires in our house for, you know, various purposes, but they are always insulated by plastic or rubber. Okay, they are not like raw wires. You can't see those copper wires. They are always insulated. So that is so that the velocity or the speed current increases. See, this is the electric wire that we have, and it always has a rubber coating around it. So same way, the axon will have a myelin coating around it so that messages are sent faster. Okay, this is the insulation for the axon. This is very important in the body because nerve fibers are basically electrical cables in our body because they send signals just like any electric wire in your house. Okay. So these also have insulation. So how does the electrical impulse travel in the nerves? Dendrites carry impulses towards the cell body and axons carry the impulse away from the cell body. Now, how does this work? This is the body. This is the nucleus. This is the body. These are the dendrites that's on the body. And this is the axon. So always current will come from this side. Electrical impulse will come from this side, will go to the dendrites, then it will go to the nucleus, and then it will go to the axon. So from dendrites to axon always. See, direction of impulse is from this side to this side. Okay. This will be the synapse. Synapse means a meeting point or connection between two neurons. Okay, they have to be connected so that the impulse will be passed. But in synapse, you have to remember that the neurons are not actually touching each other. Okay, there is always a gap between them. Okay, even though this is the meeting point, neurons are never touching each other. So this is the synapse that is formed. See this part of the first neuron and this part of the second neuron. So this whole thing is called the synapse. So before the synapse, there will be presynaptic neuron. And after the synapse, it will be postsynaptic neuron. Okay. So what are the types of nerves that we have in our body? This is important to understand. There are two types of nerves, sensory and motor. Okay. Sensory means afferent nerves. You don't need to remember afferent. You can just remember sensory nerves. Sensory nerves transmit impulses from the periphery of the body to the spinal cord and then to the brain, like touch, sight, or pain. So, for example, the senses of our body. Okay. So, if I am eating something sweet, so my taste sensation will work and sensory nerves will carry that taste sensation to my spinal cord and to my brain. Okay, this is sensory nerves. Means from the outside environment, it is taking some stimuli and taking it to the brain. Motor nerves, you can remember as a car. Car is in motion, so you can remember like that. These motor nerves carry impulses from the brain and spinal cord to all parts of the body. This causes the contraction of muscles and stimulates the glands for secretion. So, I am eating something, I got the taste sensation, and it is carried by the sensory nerves to my brain. So, my brain will process the information, then my brain will give commands again, ki do this or do that. And those commands will be taken by the motor nerves, for example, to my tongue, ki chew it, or teeth, or muscles. So that is how it works. So sensory nerves take the impulses or stimuli from the outside environment to the brain, and motor nerves send impulses to the muscles and glands. Okay, so look at this picture on the left first. This is our skin. Okay, and you can see one pin over here. If somebody pokes you with a pin, so these are pain receptors in the finger. So this is an external stimuli, right? This is a pain sensation you're feeling from outside. Okay, so what happens is, it takes, this impulse is carried by the sensory nerve. See, sensory neuron carries the nerve impulse to the spinal cord. This is a spinal cord, like cut section of the spinal cord. Then connecting relay neurons carry impulse from the sensory to the motor nerve. There are neurons in the middle that transfer information from sensory side to the motor side. Okay. And then the spinal cord will give directions. Ki, okay, a pin is pricking you. So do some action. Okay. It will tell what action to do, and it will send impulses via the motor nerve. Motor neuron carries the impulses from the spinal cord to the muscle. Then from the motor nerve, it will go to the muscle, and the muscle arm bends. For example, you remove your hand from the pin prick. That is the action. Okay. So you felt a sensation, it went to your spinal cord. The spinal cord says, "Ki, remove your hand," and it removes the hand. See, in this picture, sensory nerve tells the spinal cord that the flame is hot. Okay, this person is experiencing hot flame. This is the external stimuli. Sensory nerve goes to the spinal cord. Spinal cord will process it. Then spinal cord will say, "Remove your hand." So spinal cord sends the message through the motor nerve to move the hand. Okay, this is how it works. Okay. So brain is the most important part of the body. It controls all the functions of the body, including respiration, digestion, temperature regulation, water regulation, muscle contraction, and interpretation of senses, etc. The brain is enclosed in the skull, and it is covered by three membranes called meninges. I'm sure you must have heard about meninges. These are the covering over the brain. So from the outer to the inner, let's see what are the meninges. This is the skull from the top view. Okay. So if you can see from the outer side, there is dura mater. This skin color thing you can see, that is the dura mater. Then arachnoid matter, this middle blue thing, arachnoid matter, and this very thin sheet is called the pia matter. Okay, these are the three meninges in layer. Then the arachnoid and pia matter are separated by the cerebrospinal fluid, that is the CSF. Means this layer and this layer. Between this, there is the CSF. Okay, let's understand what are these curves or structures on the brain. Okay, so there are two things called gyrus and sulcus. Okay, so can you see these structures that are coming out, these bulging structures? These are called the gyrus. Okay, there are different names given to the gyrus, these outside structures. And sulcus is these lines that are inside. Okay, these are the sulcus. Okay, so it's just a name given so that we can differentiate the locations of the brain. Like the names are given, and these locations have these part. So coronal gyrus is this function and all of that. So that's why the names are given. You just understand that this outside thing is the gyrus and inside is the sulcus. Okay, what is CSF? Now, functions of CSF are it protects the delicate structure of the brain. Okay, just like your fetus in a mother's womb floats in the amniotic fluid. Same way, the brain is also covered by CSF to protect it. It maintains equal pressure in the brain and it acts as a cushion and shock absorber. It nourishes the brain and spinal cord. CSF can also be used to diagnose brain diseases. Okay. Now look at this structure. This is the front of the brain. Okay. And CSF is present over here and it travels. Basically, there is continuous circulation of CSF throughout the brain and spinal cord. If there is any obstruction to the flow of the CSF, it causes a condition called hydrocephalus. Hydro is water and cephalus is head. That means the baby's head bulges. Mostly it is seen in children, small children. Okay, this is the normal brain. So CSF functioning is normal, circulation is normal. If there is extra fluid because of obstruction, the head starts getting larger and larger. Okay. Parts of the brain. Now, look at this picture here. This is the front side of the brain, and this is the back side. Okay. You can just remember it by remembering this structure. I'll explain what it is, but just to see the direction, this is always in the back. Okay. And this is always in the front. So, this is the frontal lobe that comes here. This is the frontal lobe. Okay. Behind that is the parietal lobe, and occipital lobe is behind. Okay, where you keep your head on the pillow behind. Temporal lobe is on the sides. Okay. Now I will cut the brain in half. Okay, this is the brain and I just cut it in half. So let's see how I cut it in half, how it is seen. So when you cut it in half and see it like this is the cerebral hemisphere, cerebrum. Okay. One side of it is the hemisphere, sphere and hemisphere. Okay. Then inside you can see the hypothalamus. We have been talking about the hypothalamus so much in the endocrine system and everything. It is present in the brain. Okay, it is the structure over here. Pituitary gland, we have been talking about the pituitary gland also so much. It is such a small structure. See over here. Okay. Corpus callosum, this is just fibers in the brain. And this structure that I was talking about, this is the cerebellum. Okay. Then the brain extends down to pons. This bulge is called the pons, and this is called the medulla oblongata. Together, they are called the brainstem. Okay, pons plus medulla called the brainstem. So, see, this is the cerebrum, cerebellum, and this part over here together, pons and medulla is the brainstem. Now, let's see the functions in different parts of the brain. Frontal lobe, it is involved in problem solving, emotional traits, reasoning or judgment, then speaking or voluntary motor activity. Okay, if I want to do some voluntary motor activity, this part of the brain will tell me, like I'm speaking voluntarily, so this part of the brain will be stimulated. Parietal lobe is knowing right from left side. Okay, directions, then sensations, reading, and body orientation. Temporal lobe is for understanding language, behavior, memory, and hearing. Occipital lobe is for vision and color perception. You must have heard, maybe in some cases, that people who fall down on their head, sometimes they've fallen down on their head from behind, they can lose vision. You know, they can go blind. That is because they hit their occipital lobe, which is involved in vision. So, if that is affected, then the person can have blindness. Cerebellum is the most important structure involved in balance and coordination of the body and control of the voluntary movements. Okay. Brainstem is the regulatory system of the body, you can say. Basically, it controls the breathing, body temperature, all of the systems that we have learned before. It is controlled by the brainstem, like sleep, swallowing, digestion. It is all controlled by the brainstem. So this is the cerebral cortex. Okay. The main bulk of the brain, that's the cerebral cortex. It's called the cerebrum or cerebral hemispheres. This is the largest part of the brain, and a cleft divides the cerebrum into left and right hemispheres. Okay. The two masses are connected by nerve fibers. The external surface is the gray matter consisting of nerve bodies and nucleus. Okay, so you must have heard of gray matter and white matter. Okay, so gray, what is basically gray matter? Why does it look gray? It is because it has all the nerve body and nucleus. We saw the neuron had the nerve body and the nucleus. So all of those are concentrated in one place, so it appears gray. And why does it appear white? White matter appears because all the axons from the neurons are collected at one place, so they appear white. That is the gray matter and the white matter. There is no specific ऐसे difference or material कि gray matter is different or white matter is different. It's just the orientation of neurons are such in the brain that all the nerves, bodies, and nucleus are on one side oriented, shows the gray matter, and the axons show the white matter. See, if I cut the brain section, this will be the section of the brain. You can see outside all gray matter and inside white matter. These are not two different things. These are just neurons with the cell bodies here and the axons here. Axons appear white, that's why it's called the white matter. Okay. Deep within the cerebral hemisphere are the thalamus and hypothalamus. The left part of the brain controls the right side of the body and vice versa. Did you know that the left side of our brain controls the right side and the right side of our brain controls the left side of the body? Then functions of the cerebrum, obviously memory, intelligence, a sense of responsibility, thinking, all of these tasks, logical tasks, basically you can say reasoning, learning, and all of this is done by the frontal lobe, the frontal lobe that's here. Sound waves are interpreted by the temporal lobe, so are the smell perceptions. And occipital lobe receives perception from the eyes, means vision, seeing. Cerebrum controls other parts of the brain. Now, cerebrum is the biggest part of the brain, so it will control the other parts also. It controls the cerebellum, medulla, pons, and spinal cord. Cerebrum is also involved in conditioned reflexes. Now, what is conditioned reflexes? These are responses given through previous knowledge or experience. Example, mouth waters when thinking about a cake. So our body gets conditioned or used to some things, these reflexes, and we don't even realize it is happening. That is why it is called reflexes. For example, if there is a dog, you have a dog, okay, and you show that dog food, you don't even give him food, you just show him the food, his mouth will start salivating. This is a conditioned reflex. Your brain already knows ki now I'm going to get food. This is a conditioned reflex. Swimming. Okay, if you have learned swimming in childhood, you have not done swimming for 20 years. After that, suddenly you go to the pool. It's not like you will forget swimming, right? You can still swim. Your body already knows it. So, this is a conditioned reflex. Or, for example, driving. You have learned driving, okay, in your teenage. And then few years you don't drive at all. Then again you get a chance to drive. That doesn't mean you'll forget how to drive. You can still drive. So these are already conditioned in our body. This is controlled by the cerebrum. Second part is the cerebellum, it's below the cerebrum. Okay, the small part. That's how you can tell which is the front side of the brain and which is the back. Cerebellum is always on the back side. So this will be the occipital lobe that is behind your head, and below that will be the cerebellum. It lies below the cerebrum, and functions of the cerebellum are controls the voluntary muscle movements and balance. Most important structure to control your balance and coordination. So this is so important for dancers or when we practice yoga or do balance movements, cerebellum is the most important structure that coordinates everything. It controls, coordinates, and balances the various group of muscles for smooth, precise actions and maintains the equilibrium of the body. A person who has a defect in the cerebellum cannot perform these functions, like cannot have balance in the body, cannot stand properly. There is loss of balance, cannot dance, cannot do yoga movements, cannot do anything. Okay. So there is a midbrain. Okay, that is a part of the body. Midbrain is just above the pons. Pons and medulla. Uh, what are they called together? Pons and medulla. I just mentioned it in the previous slide. Pons and
Brainstem.
medulla brainstem,
Brains.
right? So this is the brainstem, and above that is the midbrain. It's a small part of the brain. It lies under the cerebrum. See, this is the cerebrum, and just below that, the fibers connect the cerebrum with the lower parts of the brain and spinal cord. It's a connection. You can see cerebrum is connected to the lower part, and the nerve cells act as relay stations. Relay stations, as in, here messages from here will go to there, from there it will go to here. Basically, a relay. Okay. The midbrain mostly controls the autonomic nervous system. Pons. Now, what is the function of the pons? This bulging thing. Its nerve fibers act as a bridge between the two hemisphere of the cerebellum and between the brain and spinal cord. So even the cerebellum is divided into two parts. Like the cerebrum is divided into this side and this side, even the cerebellum is divided. So pons basically connects those two parts, and then it relays information between the cerebellum, then the cerebrum. Basically, it's all connecting. It has to connect to different parts of the body. You can't have all of these parts working individually. They all have to work in connection with each other. It is also a center for various functions in the body. Medulla. This extends from the pons and is continues downwards as the spinal cord. So the medulla, see this medulla continues downwards as the spinal cord. Below it will become a spinal cord. This is the place for crossing of nerve fibers. Hence, it causes the left hemisphere to control the right half of the body. This is the reason that your right side controls the right part of the brain controls the left side of the body. This is the reason, because the nerve fibers, they actually cross in the medulla. That's why the connections get crossed. Vital centers that are located in the medulla are cardiac center, respiratory center, vasomotor center, and reflex centers for vomiting, coughing, sneezing. All of these centers are controlled by the medulla. If there is any problem or trauma to the medulla, all of your centers will be affected. Your respiratory center will be affected, means literally there will be no stimulus for breathing. It is that important. Now, spinal cord, it extends from the medulla to the lower border of the first lumbar vertebra. Can you see this picture? This is the vertebral column, bones. Those vertebrae that we had learned in the skeletal system, these are the vertebrae. Do you remember cervical, thoracic, then lumbar vertebrae? Okay. So this is the spinal column. In adults, it comes till L1, means first lumbar vertebra. In children, it comes till L3, that is third lumbar vertebra. So as the child grows, the spine changes the shape. It stretches a bit. So that's why it goes up. Spinal cord is located inside the canal of the vertebral column. It has gray matter in the center and white matter around it. Okay, this is exactly the opposite of the brain. Brain had gray matter outside and white matter inside. The spinal cord is also wrapped by the dura, arachnoid, and pia. So just like the brain has meninges, spinal cord also has. It's an extension of the brain, right? So all of the coverings that the brain has, the spinal cord will have. And CSF is also present in the spinal canal. The spinal cord connects the brain to other parts of the body. Okay. Now look at this picture over here. I want to clear this confusion. A lot of people have this. This is the spine. Okay. Vertebral column. Okay. So, do you remember how many vertebrae we have? Each vertebrae, we had done this. Can you tell me how many cervical vertebrae we have?
8, 8. Is it 8?
No, we don't have 8 cervical vertebrae. We have 7 cervical
7,
vertebrae.
7,
Yes.
7.
So the bones, these bones in our neck behind, these are 7. Thoracic vertebrae, how many thoracic do we have?
12,
എത്ര തവണ?
12
12.
pairs, 12
Correct.
pairs.
Yes. Thoracic vertebrae, we have 12. Lumbar, how many lumbar vertebrae?
Uh, that is the 5.
5.
That is the
Correct.
second 12,
Lum
then 5.
Correct. 7, 12, 5. You're correct. And this is the sacrum and the coccyx. So
Yeah,
what do
sacrum
you need?
also have 5.
And coccyx has 4. Okay.
4.
So basically they fuse. So we have a big sacrum bone later. But this you need to remember, vertebrae, these bones are different from the spinal cord nerves. Okay. Now we have 7 cervical vertebrae. But look at these spinal nerves. Spinal nerves are nerves that come from the spinal cord. There are 8 spinal nerves. This is the confusion people have. Okay. So you remember vertebrae we have only 7, but spinal nerves we have 8. Okay. For thoracic, it is the same number, 12 thoracic vertebra and 12 thoracic spinal nerves. Then 5 lumbar vertebrae and 5 lumbar nerves. Sacral nerves also you have 5 and then coccygeal nerves. But this is one difference you need to remember, that even though we have 7 cervical vertebrae, we have 8 cervical spinal nerves. Spinal nerves are nerves that come from the spinal cord. Functions of the spinal cord, different sensations of the body are first received in the spinal cord. Okay. Then passed on to the brain by the sensory or afferent nerves. See, the brain is the boss or the CEO, you can say. Okay. He can't do everything at once. Like so many sensations we are perceiving right now, so many movements we are doing. So what it does it, the job is given to its assistant, you can say. Spinal cord is the assistant. So all of the sensations are first seen by assistant. Then the assistant passes it on to the brain. Similarly, the impulses of the motor nerves are first received in the spinal cord and then to the other parts of the body or organ. One of the main functions of the spinal cord is reflexes. Okay, it is a self-protective mechanism. It is an immediate motor response to a sensory stimulus without consciousness. Now, what does that mean? Immediate motor response means immediate movement to a sensory stimulus without consciousness, means you don't even realize you're doing it. Like I showed the picture before of that person had a hand on the hot flame. Okay, you touch something hot and you remove your hand. You don't even realize it. Do you think, okay, now I have to remove my hand and remove it? No, you just do it. It is that quick. Okay, so this is relayed by the spinal cord. The reflexes are so fast, like within seconds the reflexes happen. When there is when there is danger in the external environment, the sensory nerves are stimulated and the body responds in a motor way to it immediately. Okay, this is controlled by the spinal cord and the brain is bypassed. Why is the brain bypassed? See, by the time all of the impulse reaches the brain, okay, there can be injury to the body. Okay, you keep your hand on some hot utensil, for example. By the time it goes to the brain, there can be some injury to the skin. So it is only going to the spinal cord, and spinal cord only gives a message ki no, remove your hand. So this is a protective mechanism. Most of the reflexes in human bodies are protective. Even sneezing. You know, sneezing is a reflex because something is irritating your nose, some dust particles, so you sneeze. Coughing also to clear your windpipe. This is a reflex. Autonomous nervous system. This makes the involuntary part of the nervous system. Till now, we were seeing the voluntary part. Motor means voluntary movements. I'm moving my hand like this. That means I want to move it voluntarily, motor system. But this is automatic. We do not have any control over this and they work automatically. We don't even come to know this is working. It controls the heart, respiratory, and digestive systems. Do you tell your heart ki you have to beat right now, you have to beat at this beats per minute? Do you keep telling your body breathe, breathe, breathe? No, it happens automatically, and this is controlled by the autonomic nervous system. So the cerebrum has no control over it. Okay, this is not cerebrum's job. The functions of these systems and organs are controlled and coordinated by the thalamus, hypothalamus, cranial nerves, and medulla. Okay, I told you all the centers, medulla has all of those centers, right? So, medulla is involved. Can you tell me what are cranial nerves? Just in one line. We learned spinal nerves. Tell me what are cranial nerves?
Starting from brain, central
Right.
nervous system,
Yes,
brain.
nerves that come from the brain. Those are cranial nerves. So see spinal nerves versus cranial nerves. We'll just see the difference. These are the spinal nerves. We learned spinal nerves, cervical, thoracic, lumbar, sacral. Same, whatever name is given to the vertebra, na, same name is given to the nerves also. No extra name is given. So what? See, these are the cervical vertebra, cervical nerves, 8, but these are 7. Then thoracic vertebra, thoracic nerves. Lumbar vertebra, lumbar nerves. Sacral vertebra, sacral nerves. Okay, just remember it like that. And this is the brain. So the cranial nerves come from the brain. These are different nerves. See, you don't need to remember the names, okay? But just remember that cranial nerves come from the brain, and there are 12 cranial nerves. Only 12, okay, in everybody. See, these are the cranial nerves. Let's just see the functions overall. So, first cranial nerve is olfactory. Olfactory means smell. Olfaction means smell. Okay. It's a sensory nerve. Function of olfactory nerve is just smelling, no other function. Second is, see, it comes from here, optic nerve. Optic nerve is for vision. Third nerve is oculomotor nerve. Okay. Can you tell me what can be oculomotor?
Is related to vision, eyes,
Oculomotor. So can you guess what can be the function? It's in the name
from,
only.
from
Motor.
brain, from brain to this.
No,
Uh,
function. What can be the function of the oculomotor? Optic nerve is for vision, okay, but oculomotor, something related to the eye, oculo, and motor. That means
from the impulse from the brain of
to do what function? Okay, it is to do movements of the eye. Oculomotor means eye movements. Okay, so this is for the movements of the eye. This is the trochlear nerve. Trochlear nerves serves again eye muscles only. Trigeminal nerve. See, these nerves can be only sensory or sensory and motor. You can see over here, some are only sensory and some are sensory and motor. Both function they can have. Okay. Trigeminal nerve, sensory from the face and mouth. See, all of the sensations that you have on your face, it is all trigeminal nerve. You touch over here, this is trigeminal nerve. Okay. These all sensations, but it has motor functions also for muscles of chewing. You chew your food, it is again this nerve only. So it's not like ki this one nerve will be only sensory or one nerve will be only motor. They can be both motor or sensory. Abducens nerve, again for muscles of the eye. Facial nerve. Facial nerve is very important. Where have we studied facial nerve? Can you tell me? Or can you tell me one disease or disorder of facial nerve that happens? Very common. You must have seen in people around you.
some facial, some stroke comes,
Okay.
some stroke comes. face will move to
Yes, face changes, right? So this happens in facial nerve paralysis. When there is facial nerve paralysis, okay, facial movements are not possible. Okay. See, serves the muscle of facial expression. Whatever expression you're doing, you're smiling, you're frowning, you're crying, you're raising your eyebrows, whatever, this is controlled by the facial nerve. It also controls the lacrimal glands. Lacrimal glands means tear and salivary glands. Then vestibulocochlear nerve. This is for hearing. Hearing is again a sense. So this is sensory gland. It is also related to equilibrium or balance. You know, a lot of people who have hearing problems have balance problems also. They both are interconnected. Then glossopharyngeal nerve, again, for taste sensation, okay, and swallowing. Vagus nerve, you must have heard of vagus nerve. It is very common, okay. Sensations from the organs and parasympathetic motor regulation. Accessory spinal nerve serves the muscles that move the head, and hypoglossal nerve is serve the muscles of the tongue. Basically, I just want you to have an idea कि we have all of these 12 nerves, cranial nerves, and they have different functions in our body. So the autonomic nervous system is divided into sympathetic and parasympathetic. Sympathetic nervous system is responsible for the fight or flight response. This system prepares the body for physical activity. It's activated when the body is in danger or the body is in stress. And parasympathetic nervous system is the exact opposite of it. It's called the rest and digest response. This system relaxes the body after a period of danger. See, this is the sympathetic system and parasympathetic system. These are just the functions. You can see what will the sympathetic system do in the same organ and what will the parasympathetic system do. In the eye, if you can see, sympathetic system will dilate it, but parasympathetic system will constrict it. Here it increases the heart rate. You know, sympathetic stimulation increases your heart rate, right? But parasympathetic will slow it. These are the exact opposite of each other. Airways, like your breathing pipe, dilates the bronchial tubules. This constricts it. There's no sweat gland over here. Sweat gland is stimulated by the sympathetic nervous system for secretion, so sweating. Over here, liver increases the rate of glycogen to glucose. That means in a state of fight or flight, okay, when your body is stressed or tense, you will need more glucose, right? The body needs more glucose. More muscle movements are happening. For example, if you're running away from something, if you're in fear, okay, more glucose will be consumed by the body. So the liver will change the glycogen to glucose. But parasympathetic system does the opposite. It stimulates the bile release. Okay, it does not release glucose. Blood vessels, this does constriction. Then digestive system stimulates the activity. Digestive system decreases the activity. In a state of fight or flight, you're not thinking about digestion, right? You're just thinking about getting out of there or some stressful activity. So digestive system decreases this activity. But in parasympathetic stimulation, it is stimulated. Again, the adrenal glands stimulate adrenaline. Then uterus, there is vaginal contraction and there is vaginal relaxation. Urinary system, it relaxes the bladder and here it increases the urinary output. Basically, it is just the opposite of each other. These are two systems in our body that work opposite to each other according to the situation. Okay. Can you tell me what are the hormones of the sympathetic nervous system and the parasympathetic through which it works? There are hormones in the sympathetic and parasympathetic system. So, what are those hormones?
adrenaline,
In which system?
sympathetic,
Yes, adrenaline, correct. In sympathetic system.
cortisol, cortis,
Um, Not exactly cortisol, but okay, you can consider that. But main is adrenaline and noradrenaline. Okay. And parasympathetic?
Dopamine, serotonin,
No, not dopamine and serotonin.
relaxation hormones.
It is acetylcholine.
Acetylcholine. Okay.
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 See, sympathetic nervous system, you have epinephrine means adrenaline and norepinephrine is noradrenaline. These are just different names. And parasympathetic system, there is acetylcholine released. This is the sympathetic pathway. This uses norepinephrine. If you can see, central nervous system goes to the ganglion and it stimulates the release of norepinephrine. And this is the target tissue, whatever tissue it wants to give it to. Then parasympathetic system, you can see, again, stimulation is done and ACH means acetylcholine that is released. Okay. Again, these are the effects that you can see in sympathetic and parasympathetic nervous system. Okay. Bladder also you should see delays the emptying in sympathetic situation. In flight or fight response, it delays the emptying or relaxes the detrusor muscle because the body is trying to get out of a stressful situation or you can say fearful situation or run away from somewhere. So then it relaxes the body and doesn't put more stress on it. Now you have to go and urinate or now you have to go and go to the washroom. So it just relaxes the body. But in parasympathetic system, it's relaxed. Okay, so it empties the bladder. There is contraction of the vessels. Okay. Now these are the Brodmann areas of the brain. So the brain is mapped. A lot of scientists went and they mapped the brain, right? So they made areas. Ki this area does this function, this area does this function. So they were named. Okay, you don't need to remember the names, but you need to know that this area is divided into different areas. Okay, this brain is divided into different areas. This is not structurally on the brain. You need to understand that the brain is just normal. This we have made it. We have made it like this. This area is for this function. Okay. Can you tell me which is the front side of the brain and which is the back side of the brain from this? Can you recognize which is the front and which is the back?
The foremost is the first. That is the where it's anterior speech area वगैरह. So that is the front, and the secondary that is the last visual.
Yes, you're correct. This is the
The-
front side, correct. And this is the back, okay? If you cannot recognize this, you can just remember that the visual area is always on the back. Occipital lobe is always on the back. Okay, so that also you can remember. So if you see, this is the primary motor area. Motor means functions, and primary sensory area, sensations. Okay, this in the occipital lobe behind you have the visual areas. Okay, this is a speech area. Again, this is speech area. This is the auditory area, means for listening. These are just a few functions. I'm not going to go into all of them, but a few of them you can see, like the primary motor cortex. This is the voluntary muscle activation. This primary motor area, this purple one. Voluntary muscle activation. This is the most important area. From this area, signal goes for uh, voluntary muscle action. So if there is a problem in this area, then there can be paralysis. Okay. Then let's see. Yeah, prefrontal cortex. Prefrontal cortex. It's actually over here. It's not mentioned here. Prefrontal, before the frontal lobe. It makes up a individual's personality. Okay, it has a regulator of the person's depth of feeling and has an influence in determining the initiative and judgment of an individual. Prefrontal cortex in people matures at a very late age. Usually, the brain matures by childhood. you can say. But prefrontal cortex matures at a very late age. So if there is a lesion in the prefrontal cortex, the person can lose initiative and judgment. Okay, then there can be emotional changes. There can be personality changes. Okay, person no longer conforms to the accepted mode of social behavior. Okay, that person starts behaving abnormally. That is not socially acceptable. Then Broca's area. Broca's area, this is the Broca's area, one small area. This is a speech area. Okay, that means motor aspects of speech. Now I'm speaking. How am I speaking? Because the brain, this area is giving sensations. Then that's why I'm speaking. If there is a lesion or problem in this part, then the person will not be able to speak. Okay. Now, let's see primary sensory cortex. This is the primary sensory area, main sensory area where all the sensations are perceived. Okay. If there is a problem in the sensory area, what will happen? The person will not be able to judge the degrees of warmth. Means the person will not be able to feel hot stimuli you give, cold stimuli you give, you put ice on that person, the person will not be able to feel. Okay. Then to localize tactile stimuli, that means if you touch the person in that place, the person will not be able to feel ki this, like I'm getting touched. Okay. And he'll not be able to accurately judge the weight of the objects. Okay, you will give him a 1 kg dumbbell or 5 kg dumbbell, that person will not be able to feel the difference because the senses are gone. Basically, primary sensory cortex means senses are gone. Okay, so there will be deficits in the sense of touch, vibration. Okay, then taste area, there is a taste area also in the brain. It's not given over here, but there is a taste area, and if that has a lesion in it, there is loss of taste. Okay, these are just few areas, okay, that in the brain and their functions. Okay, can you tell me what are the common diseases, disorders, or syndromes, or anything of the brain that you know of? Any diseases, any disorders of the brain?
Stroke,
Stroke, correct. What else?
paralysis, paralysis,
Paralysis happens in the body. Yes, paralysis is a symptom because of stroke, I agree, but it happens in the body. What happens in the brain? Like,
meningitis,
yes, correct. Meningitis. What else?
uh, Parkinson's disease,
Correct. Parkinson's, yes. All of these are related to the brain. What else? There are a lot of diseases that you hear in normal day-to-day life also.
Memory
Just
loss,
think.
Alzheimer. Hello,
Alzheimer's is correct. Memory loss is a symptom, but Alzheimer's is a condition.
symptom.
Hello.
Yeah.
Yeah, yeah. Alzheimer's is correct. What else?
As the nervous system is very important factor, so uh,
Okay, we'll see the disorders. There is a difference between psychiatric and neurological disorders. Okay, this a lot of people cannot differentiate between this. It's very important to realize that psychiatric is different and neurological is different. Okay, neurological is basically something that affects the structure or the physical components of the brain. Okay, so for example, can you tell me if Parkinson's disease is psychiatric or neurological?
neurological,
Correct.
mm,
psychological.
Psychiatric, yes.
Psychiatric.
Yes. Depression is psychiatric. Multiple sclerosis,
Neurological.
okay.
Neurology.
Tourette syndrome, do you know
याच्यात
Tourette
ठेवते
syndrome?
मी psychiatric,
Yeah, migraine,
Neurology.
neurological. Maybe
okay.
it is both, ma'am.
Um, no, it's not both.
Because
Okay, I
no,
just want to see how much you can.
I'm
No,
just
it's
want
not
to
both.
confused migraine because if the stress level is also there, so is it going to be happen?
I will tell you in
Maybe
the
okay,
upcoming
okay,
slide.
okay,
Okay, let's just go
okay.
with this schizophrenia,
Psychiatric.
Psychiatric,
psychiatric, Alzheimer's,
neurological,
yes, bipolar,
Psychiatric.
uh,
Psychiatric.
psychiatric,
huh,
Psychiatric.
correct.
ADHD.
ADHD, yes.
Psychiatric.
Anxiety,
psychiatric,
psychiatric. Stroke,
Neurological.
neurological,
correct. Epilepsy,
Neurological.
yes. Epilepsy, seizures. Myasthenia gravis, you know
Neurology.
myasthenia gravis?
no,
Okay,
neurological,
okay, let it be. Then psychosis,
Psychiatric.
sorry, psychiatric,
psychiatric. And autism,
Psychiatric.
neurological,
neurological or psychiatric?
sorry,
Psychiatric. Psychiatric.
neurological.
It is psychiatric. See, these are the psychiatric and neurological disorders. PTSD, post-traumatic stress disorder, is psychiatric. ASD means autism spectrum disorder. Autism is also psychiatric. This is major depressive disorder, means depression and everything. OCDs are psychiatric. Schizophrenia, psychiatric. Tourette syndrome is also psychiatric. ADHD, again psychiatric. Anorexia nervosa. Have you heard of anorexia nervosa? Anorexia nervosa
Food,
is a condition where
food,
the person uh, has a psychiatric condition where they want to get thin a lot. They are very malnourished, even though they are underweight. They are very thin. They keep on working out. They keep on doing dieting, and they are very, very thin. Okay, like literally, you can say malnourished people, but still they think they are not thin enough. So they become very, very thin. Basically, you can say. Bipolar disorder, again psychiatric, and anxiety is also psychiatric. Okay, migraine will come over here. Neurological disorder. Okay, it is not exactly a psychiatric disorder. uh, yes, stress can be a factor, but it is more of a structural component that comes in migraine. That's why we have so many inhibitors of hormones and those drugs that are given in migraine, right? So migraine is a neurological disorder only. Then multiple sclerosis is, epilepsy means seizures. Seizures can happen because of structural abnormality. Stroke is very common, Parkinson's and Alzheimer's. Okay, these are all neurological. Let's study what is stroke. This is when the blood flow to the brain is stopped, or when the blood vessel in the brain bursts. Okay, so we have blood vessels in our brain. So what can happen is, can you see there is a plaque formation, fat formation? Okay, and then it gets stuck. This clot gets stuck. So blood flow stops to the brain. Ischemic means there is a clot over here. Again, blood clot. Blood flow is stopped, or the blood vessel will only burst. Okay, then blood will go out. So this is stroke. Can you tell me the risk factors for stroke?
Stress, then high BP,
I'm sorry, what did you say?
stress,
Okay.
high BP,
High BP
then
is exactly right.
uh, bad cholesterol, fats,
What is good cholesterol then?
I don't LDH or HDL, something like that, na, so I'm not aware
There
about
is,
LDH or
yes, before there was a concept like that, but now there is no concept like good and bad cholesterol. These are
oh,
just layman's terms that people use. Okay. But yeah, you can say high raised cholesterol in the body, not good or
yeah,
bad
raised,
cholesterol. Okay.
okay, raised cholesterol
Yes,
in
yes,
body. Then fats also, liver, fatty livers, and that fat is transport, something that creates the blockages.
yes. Okay. Basically, obesity.
Yeah, obesity.
Yes. What else can you think of?
Di- diabetes.
Okay. Yeah. Diabetes can cause high BP also, so that can cause stroke. Okay. See, risk factors are high BP, smoking, high cholesterol, obesity, diabetes. Any cardiovascular disease means if the person has some heart disease from before, okay, that can also increase chances of stroke. Family history also. End stage kidney disease, migraines with an aura. What does this mean? If you know somebody with migraines, okay, you'll know ki there are two types of migraines that come. Okay, one migraine is with aura and one is without. With aura means that person realizes that he or she is going to get migraine before they get it. They have some like cannot be explained exactly, but some sensations you can see. Ki they already know ki I'm going to get a migraine now. That is called the aura. Okay, and lack of physical exercise and unhealthy diet.
So, ma'am, I have one question because I'm suffering from migraine. So, how
Yeah.
it comes to be migraine as a stroke? And what you
Migraines,
say that migraine with aura, that is the symptoms that before means if you have that nausea or pain in your neck region, and
yeah,
that is
you get
migraine with
a
aura.
aura. Yeah, see, you realize it before it is happening only. That do you get this sensation ki, okay, now I'm going to get a migraine, as minute sensations from somewhere, like an aura, this feeling you have ki I'm going to get a migraine, or do you suddenly get it?
That is the pain started suddenly get it most of the
Okay.
time.
Okay. So a lot of people have aura before only, before the headache starts. You know, migraine people have one-sided headache. Before it
Sorry,
starts, they
yeah,
have this.
me also that migraine, but every time I can understand that migraine will start because of my something has come and I can understand that migraine will start.
Then that is the aura. That is the feeling that the person gets. Ki, okay, I'm
Yeah,
going to get a migraine now. That is
exactly.
migraine with aura. That is one thing. These are just for differentiation. Okay, it's just to show. Okay,
No, my
migraine with
question is
aura and
how
without
it
aura.
yeah, how it's that is the cause of that is the stroke, brain stroke.
Okay, this is actually what happens is it is not exactly clear, but in migraine, na, there is vasoconstriction of brain blood vessels. Okay, this is also a reason there is vasospasm or spasm of the vessels. So because of that, blood flow can reduce in the brain. This can be one thing, but it is not exactly the pathophysiology is exactly not clear because migraine itself is so complicated, it is not clear. That's why you have very limited medication options also. Do you take medications? Have you consulted
Previously,
anybody?
ma'am, no. Previously, that is the plurarin 10 was given to me, but later on, when I came into the path of that is the yoga, mostly I controlled whatever the
You can
food habits
control
and
it. Yeah,
lifestyle. So that is
exactly.
the control.
So,
But if I just find
correct.
if a stress level or something is that is the raised, so
That's a
then such
trigger.
kind of yeah, that is the only
That's a
trigger.
trigger. Yes.
But
A lot
previously
of
it
people
was
have.
very yeah.
Yeah.
Previously, it was very high. That is the nausea, not even have the feeling, means sound जे काही ऐकायला येतं ते
Yeah.
म्हणजे
Oh,
व्हायचंच नाही. But now,
yes.
because of the yoga and all that
You
practices and food
controlled it.
habit and lifestyle.
So you can see this is such a multi-factor doctoral control, not only medications, lifestyle exercise is also needed. This kind of a disease. Not only stress, light also for some people.
Yes, for me, if I go in the sunlight,
Yeah, exactly.
and the acidity also.
Yes, so this is such a different combination of trigger factors and everything, but the pathophysiology is basically there can be spasm of vessels in the brain. See, this is not always a sure shot thing. If you have migraine, you'll have stroke. It's not like that. Okay, but we have to include all possibilities of risk factors. That's why I am including this. Now, family history also. It's not like diabetes, you can say. Ki if my parents had, both of them had diabetes, that means I have very high chance of diabetes. That doesn't mean that, if somebody had stroke, their children will have stroke. Okay, we just give risk factors. We don't say ki this is a confirmed thing, so you don't need to worry ki just because you have migraines you will have stroke. You don't need to worry at all. Okay, and this is in very severe migraines people have that are not manageable. You have managed it with yoga or a medication. That means you have mild migraines, right, that are manageable in day to day life, right? There are people who cannot manage their migraines at all. They are so severe, like they have to get hospitalized, that level. Okay, so don't get scared that just because it's mentioned as a risk factor, it will lead to stroke. Okay, now
No, no.
obesity
Previously,
also.
I thought that it is psychological, but here in the term of that is it is neurological.
Yeah,
That
because
difference
there
I
is
also need to clear.
yeah.
That is.
Yeah, it is not a psychiatric thing because migraines have a structural pathology. Okay, you can describe it in the brain. Okay, like anxiety, you cannot exactly describe in structure. Ki, okay, I'm suffering from anxiety. So, what is happening in my brain? Are you getting the difference? Like structurally, you can't see, right, what is happening in your brain. I don't know how clear I am, but I'm trying to explain the difference between psychiatric and neurological. Like, see over here. Now you have OCD also listed over here. Okay, OCD is a psychiatric disorder. You can't explain it neurologically. If somebody has OCD, that doesn't mean they have a different brain or they have some, thing happening in their brain like vasoconstriction or vasospasms or some different hormone is being released. That's not how you can explain it, right? So basically, you need to understand that. Now, post-traumatic stress disorder also, this is also psychiatric. This is after the person has suffered from some traumatic event. Mostly, soldiers have this after they come back from war and everything, they have post-traumatic stress disorder. Does that mean that their brain is doing something abnormal? No, it's not that. But in Parkinson's, there is an abnormality. In Alzheimer's, there is an abnormality. You can see the abnormality. In PTSD, can you see the abnormality? No. So, are you getting the difference? I'm trying my best to differentiate, but are you getting it? Okay. So, symptoms of stroke. This is very important to understand because if there is a person around you who is suffering from stroke, you can identify it very quickly and then take them to the hospital. Dizziness, speech disorder. If somebody's suffering from stroke, na, suddenly they start speaking in a different manner. Like they will stutter their words or something will happen. You'll realize that this person is not speaking normally. Hemiparesis means weakness on one side of the body. Only one side of the body weakness. Maybe they are holding something and suddenly something falls down. Example. Okay. Tingling, numbness, thunderclap headache. What does this mean? Thunderclap headache is basically, you can describe it as the worst headache of your life somebody can get. It is so severe. It is described as the worst headache of your life. That's why it's called thunderclap. Okay, headache. Then facial asymmetry. Can you see this person over here? He has asymmetry in his face. That's because he suffered from a stroke
No.
and one side of the face is paralyzed.
Yes.
Drooping eyelids. Okay. Eyelids will be drooping and inability to close the eye. The eye will not work. Which nerve controls the facial expressions and all of that? Which cranial nerve? I told you a cranial nerve that controls your expressions. Which nerve will affect your expressions or control it? Like I'm smiling or I'm frowning. Your facial nerve. Facial nerve will control your facial expressions. Okay? Balance problems and visual disturbances. In movies also you must have seen suddenly this person starts having a asymmetrical face. There is drooping of saliva from here. This is the symptoms of stroke. So if somebody around you is having stroke, what are you supposed to do? This is the you can say first aid thing that anybody can do. You don't need to be a doctor, okay, to diagnose this. Okay, so this is the acronym. You can say be fast in stroke. Be fast. B means balance. You have to see if the person is losing balance. E is eyes. Has the person lost vision? F, face. Does the person's face droop? A is arm. Is there one arm weakness or numb? I said one side of the body gets paralyzed. Then S is speech. Is there slurred speech or strange speech? And T is time. When did the symptoms start? So be fast and stroke. If you remember only this much now, you will be able to diagnose very quickly that this person is suffering from a stroke and then take them to the hospital, because timing is very important in stroke for the degree of damage. Okay. So treatment of stroke is anticoagulants, blood thinners, then thrombolytics. Mechanical thrombectomy is basically they go in and remove the thrombus. What is a stroke? Stroke, we learned that it is a blockage in the brain blood vessels. So they remove it. Craniotomy, then antiplatelet drugs like aspirin, statins to lower the cholesterol, physical exercise, control of the BP and diabetes, angioplasty. Basically, this is all to remove the risk factors. Okay, stroke. Now, Parkinson's disease, which is the implicated neurotransmitter in Parkinson's? Because of which hormone or neurotransmitter Parkinson's disease occurs? I know you have had a homework on Parkinson's. I remember ma'am saying it. So I know you have studied Parkinson's. Okay, deficiency of which hormone in the brain?
Ma'am, Parkinson's disease is caused due to the last of the part of the brain that is called the substantia nigra.
100% correct, 100%.
Yeah,
But
that
what
is the
does the
homework which was given.
okay. So
Yeah,
what does the substantia nigra secrete? That is the
dopamine,
important.
dopamine,
Yes, correct.
dopamine.
Dopamine. Yes, dopamine is
Dopamine
the
acts as a messenger between the
yes,
parts of the brain and the nerve system.
yes, correct. So Parkinson's disease is an age-related neurodegenerative disorder. Okay. There is a degeneration of nerve cells in the substantia nigra, a region that produces dopamine. This is the healthy substantia nigra. Okay. In the healthy brain. If you see a cut section of the brain, you can actually see a black line, thick black line. That's why it's called substantia nigra. Nigra means black. This is actually seen on the brain. So that is the region that secretes the dopamine. And this is the healthy dopamine. Can you see? And in Parkinson's disease, dopamine is very, very deficient. What are the symptoms of Parkinson's disease?
That is the shaking of the hands or the body parts.
What are
Can't
they called?
hold the things.
Correct. You're correct. You're describing it. What are the shaking called?
No, I don't have any idea.
Tremors.
Yes, yeah, they can't hold anything tightly.
And what else?
Drooping body.
Yes. Yes. Okay, if you're sitting somewhere and in a public place and you see some person with Parkinson's walking, how will you identify? That person won't be shaking all over. So from far,
Shivering,
how will you identify?
shivering all over, tremors all over the body.
And they don't shiver all the time. It's not like all the time. But if you're sitting here, just imagine a Parkinson's patient is walking. From far, how will you tell, yes, he has Parkinson's? It's very
Maybe
characteristic.
he could not move as the common people we can move.
Yes, yes,
So
you are
that is
right. But then how does he move? Slowly, yes.
very slowly. And if we just look their hands, so mostly their hands shake,
Yes,
shiver. So
yes.
that is a very slow sensation or slow shivering is there.
Yeah,
And they are
okay.
not too much confident.
Yeah, okay. They're not confident, fine. But if you can't see the tremors, okay, that person is far away. How can you identify? Very characteristic thing.
Their neck or the head is moving a little bit. That is it is not straight or fixed like that.
Groove in the neck.
No, head means.
Oh,
Sorry,
I
ma'am,
have
you
not.
continue.
No, I have not heard of. Okay. All the other symptoms were correct. This last one, I don't know, but we'll see. Okay. So the symptoms are tremors, okay, dementia, person keeps forgetting everything, balance problems, mood swings, sleep abnormalities, and bradykinesia means slow movements. All movements will be slow. Whatever the person will do, even if he is trying to lift something, do everything will be slow. Rigidity, okay, this is what I was talking about, shuffled gait. If you're sitting over here and there's a person of Parkinson's walking from far away, you will be able to tell he's Parkinson's patient because they will walk in a shuffled manner. As in, see, we walk like this. That person will walk like this, like shuffling their feet. Can you imagine like this? Very slowly. Are you getting the type of walking I'm trying to tell? Us? Ekdam slowly, slowly, ekdam slow walking. And you will be able to tell ki this is a patient of Parkinson's. And very slow they'll walk. They have a mask-like face, no expression. That's why it's called mask-like face. Then stooped posture, constipation, depression, and psychosis is also a symptom. There is reduced arm swinging also. You know, when we walk normally, we have a certain degree of arm swinging. We don't even realize, but our arms swing. Not like in the cartoons, just normal. But they have reduced arm swinging. They'll be very rigid. Okay. See, this is a shuffling short gait. Very slow. They will be walking. Treatment of Parkinson's, there is no definite cure for Parkinson's disease. At the most, what you can give is dopamine. So, dopamine is given in the form of levodopa. This is a drug. Surgery, you can try deep brain stimulation and lifestyle changes and palliative care. Parkinson's patients need lifelong care for everything because after a certain degree of time, they lose their bowel and bladder control also. Okay, so they need to be cared for like any hospice patient or old patient. Now, Alzheimer's disease, this is also a neurodegenerative disorder. And the most important risk factor in this is apolipoprotein E. That is actually a lipoprotein or protein in our body. There is accumulation of malformed protein deposits. Means, see, there is normal synthesis of protein in our body. But when there is abnormal synthesis, okay, there is deposition of those proteins in the cerebrum called amyloid plaques and neurofibrillary tangles. These are very medical terms, but you just remember that there is some accumulation of malformed proteins. Okay, these misfolded proteins aggregate and interfere with the normal cell function. And over time, they lead to irreversible degeneration of neurons and loss of synaptic connections in the brain. See, these proteins are not normal. So they are going to disrupt the brain functioning. Just remember that. These are the symptoms of Alzheimer's, dementia. Now, what kind of dementia? There are different kinds of dementia. So, in Alzheimer's patients, they have trouble in remembering recent events. Okay, you have a 6-year-old person with dementia, they will have trouble remembering what they did yesterday or last week or at the most last month. But if you ask them, Ki, what did you do in your college days? They will remember. So dementia doesn't mean ki they have forgotten their entire life. Okay. It is actually recent dementia. It starts with recent dementia. When it gets severe, very severe, then they just forget everything. But most patients remember their uh, past, you can say, not recent past, old past. Then disorientation, problems with language, there is decreased fluency, planning of the task becomes difficult, they can't make judgment, decision taking is difficult, depression, wandering. This is a very common symptom. Alzheimer's patients wander around a lot, they don't know what they're doing and they just start wandering. Anger or aggression, sleep disturbances, and they need help with daily activities. Epilepsy, this is interesting. So, epilepsy basically means recurrent seizures. Seizure means one episode, and seizure happening again and again and again means epilepsy. Okay, there is an excessive abnormal electrical discharge in the neurons. Normal discharge, we learned, it goes from the dendrites to the cell body to the axon. This is normal flow. Now just imagine lot of discharges, lot of electrical impulses coming to the neurons. Like a traffic jam, you can say. Okay, so that is what causes seizures. See over here, your brain has billions of cells called neurons that all connect to create electrical networks. Okay, this network would be similar to road traffic lights. Just imagine all of these traffic lights are neurons and they are connected by roads. Then those networks make up and connect different parts of your brain. Okay. Seizures happen when the neurons malfunction and electrical signals fire uncontrollably. Like, for example, the traffic lights, okay, they stop in your city. So there is a lot of traffic jam, right? So that is the cause for seizures. The more neurons that go haywire, the more intense is the uh, seizure. Are you getting why seizures happen? Or should I explain again? Are you getting why seizures happen? Or should I explain again? Not getting? Okay.
The
Uh,
neurons malfunction is there. Yes.
yes. Electrical activity goes through the brain, normal electrical activity. Okay. Like just imagine a car going on a highway or a road, normal road. Okay, this is normally happening. Then suddenly your traffic lights stop. Okay, and then there is a traffic jam. Whenever traffic lights stop, there is a traffic jam, right? So same happens in neurons also. When everything is working normally, normal electrical impulses are going. But when there is abnormality, a lot of cars come or lot of impulses come, lot of electrical signals come at a time, overpower हो जाता है basically, so that is called a seizure or epilepsy. If you can see these waves over here, see these are the normal waves, and suddenly can you see this? This is the seizure. This is seen on the EEG. For heart we have ECG, electrocardiograph. For brain we have EEG, electroencephalogram. So basically waves are seen. See again, this is normal, and these are the seizures. The sudden excessive activity of the brain. firing of neurons. Lot of neurons fire at the same time. Okay. Most causes are unknown, but stroke can be a reason. Brain injuries, genetic brain tumors, and infections. Risk factors are children and elderly. Seizures are mostly seen in children. Okay. Family history and having long duration of fever plus seizure in childhood. A lot of kids have fever with seizures. Okay. I don't know if you must have heard prolonged fever they have, and they have seizures during the fever. So this is a risk factor. What are the symptoms of epilepsy? Involuntary muscle contraction. Sometimes they have a staring spell. Staring spell means you will not even realize the person is having a seizure. They'll just keep staring in one place. Just ekdam still, and they'll keep staring. They'll not move, they'll not do anything, just keep staring. This is also one of the symptoms of seizure. Loss of consciousness, obviously, jerky movements, flashing lights. They see flashing lights on their eyes and sudden falling on the ground. You must have seen in movies people having seizures, they just move around and, fall down with intense actions. See anxiety, loss of consciousness, muscle contractions, weakness, and staring. Now, what are the types of seizures? Absence seizures. This is what I was talking about. Staring into space without any body movements. These cause a brief loss of awareness. They keep staring at something, they are not realizing they are staring. And you also don't realize that person is undergoing seizure. It's a type of seizure. Then tonic seizures. These cause stiff muscles and can cause loss of consciousness. And it may cause the patient to fall on the ground. Atonic seizures means drop seizures cause a loss of muscle control. Clonic seizures, again, repeated or rhythmic jerking muscle movements of the muscles. Tonic-clonic seizures, these can cause a loss of consciousness and body stiffening, twitching, and shaking. There can also be loss of bladder and bowel control. Now, what to do when a person has seizure? Okay. Uh, I'll tell you one incident. This has actually happened. I was in class 10th that time, and we had a trip, okay, like a conference trip. And we had gone and stayed in hotels, all the students. We were living in hotels. And with us, our biology teacher was assigned. So one boy from my class, Chaitanya, I still remember, he suddenly got an attack of seizure in his room. Okay. And he had his roommate with him. Obviously, we are in 10th standard, we didn't know anything that time. He had an attack of seizure. So his roommate, he ran to the teacher, our biology teacher, and called her. Okay. And she came running. And obviously, she's not a doctor, she's just a biology teacher. But she had this first aid knowledge of what to do. So what she did was she turned the boy on his side, Chaitanya on his side, and she put a metal spoon in his mouth. Okay, just to keep his mouth open and turned on the side. And she kept a pillow under his head and she waited for the seizure to pass. After it was done, then she called the doctors. So this is basic knowledge is also important, to know what to do if a person suddenly has seizure around you. Okay. So what you should do is, first, if the person has seizure, you have to see for how long they're having seizure. Okay. Make sure your surrounding is safe, or lay the person on the ground. Okay, you have to make sure somebody is having a seizure in the car. Now, it is very important that you uh, park the car to the side. The environment has to be safe. Okay, loosen any tight clothing and remove any objects that may obstruct the airway. For example, tie. People are wearing ties or necklaces, tight necklaces or anything. Remove that instantly. Okay. Then protect the head by placing something soft underneath it. If you have a pillow, keep a pillow, anything, blankets, just keep a pillow on their head. Because what happens usually, people jerk while having seizures, so they can hit their head. Then do not insert any object into the mouth. Okay. Uh, my teacher, she inserted a spoon in the mouth just so she thought it'll keep his mouth open. Okay. It worked that time, but that is not a recommended thing that you should do. Okay. So don't keep anything in the mouth. This may obstruct the airway, and do not restrain the person from jerking. This is very important to understand. A lot of people try to stop the jerking or like hold the person. Don't do that. Let the seizure finish, Whenever possible, gently roll the person to the left side. Uh, why do we roll the person to the left side or to any side? Can you tell me?
So he can breathe properly at least.
Yes, yes, so that the
There's a
person can
first
breathe.
aid.
Yes, roll them to the side so that they can breathe. Because if there are any vomiting or secretions happening, the person should not choke on it. So roll them to the side and stay with the person until the seizure is over. So this first aid is very important to remember. People also put something rubber or you can say some small thing in their teeth, because when people are having seizures, they clench their teeth and they can, yes, they can break their teeth also. So you can put some cotton, not cotton, I can say kapda or something, just to protect that if possible. If not, it is fine, just roll them to the side. Okay. Then the treatment for epilepsy is obviously anti-epileptic drugs, and there is surgery that can remove the affected part of the brain. There is deep brain stimulation and a ketogenic diet. This is recommended for epilepsy. Now, what is a ketogenic diet? High, strict fat diet and low carb diet. But this is only tried in children. This is not tried for adults. Meningitis. This is the last disease. Okay, it is the inflammation of the meninges around the brain. This is the brain. So from outside to inside, let's see dura mater, arachnoid matter, and pia mater. What are the causes? Infections, basically bacteria, virus, fungal, tumor. This all causes meningitis, meningococcus, pneumococcus. Symptoms can be fever, intense headache, neck rigidity. Okay, the neck becomes very rigid. Then vomiting, rash all over the body. In meningitis also you get rash all over the body. Photophobia, that is sensitivity to light, altered mental state, and seizures. What are the prevention? Prevention is mostly vaccination in babies. We give pneumococcal vaccines and meningococcal vaccines in babies. Now, those are preventive. Those should be given. And avoid contact with patients because obviously infections can be spread. Antibiotics and steroids are the treatment. Now, nervous system and NYS. The capacity of the brain is immense, but we barely use our brain to its utmost potential. The ultimate aim of yoga and NYS is to make most use of your brain. Some voluntary control can be brought on the respiratory system, and to do this, the cerebrum has to be involved. Remember that the cerebrum controls the voluntary movements, okay, of the body. When the cerebrum is involved, the thought process slows down and concentration increases. This calms the mind. Mainly pranayam helps to achieve this voluntary control and breathing control. When we close our eyes during the practice of asanas and pranayam and concentrate on our inner awareness, most of the outer stimuli that are disturbances are blocked and the mind fully concentrates on the body. This helps to achieve a higher sense of self awareness. Some yogic and NYS practices help to bring about voluntary control of few involuntary organs. Pranayam helps to exert control over the abdominal muscles, diaphragm, and rectal muscles also. People who achieve higher yogic status can control most of their organs. With regular practice of NYS, pranayam, and relaxation techniques, emotions and thoughts can also be stabilized. Working of the cerebrum also improves. Proper practice of yoga and NYS improves the neuromuscular coordination, the coordination between your muscles and your nervous system. When stress and tension are properly managed, the activity of the sympathetic nervous system decreases. and that of parasympathetic nervous system increases. I told you sympathetic is the fight or flight, and parasympathetic is rest or digest. So when the stress and tension is managed, sympathetic activity decreases and parasympathetic increases. So this improves the mental balance, which in turn reduces the load on heart and respiration. Remember, I told you sympathetic increases the heart rate and parasympathetic decreases the heart rate. So this can be achieved with proper management of stress and tension. Study of yoga and NYS improves intelligence, knowledge, and concentration, memory, understanding, and awareness. Yoga sadhana and NYS increases spiritual strength. The aim of practicing yoga is to awaken the Kundalini, and it is related to the nervous system. Okay, thank you. So we are done with our anatomy and physiology lectures. Okay, I hope you enjoyed the lectures.
Yes, surely, ma'am. It's very well explained with the PPTs.
Thank you.
Thank you. Thank you.
Bye.
Bye.
Thank you so much.
Thank you very